So how do you actually do a proper hand scrub? In this video today, we're going to be talking about scrubbing your hands before surgery. How do you actually do it? What's up everyone, this is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. So, before every surgery that we actually perform as surgeons, we have to scrub our hands. And usually that's the first thing that we do in the morning before starting our day. Surgical site infection is a big problem in healthcare, and one of the ways we minimize infections in surgery is to scrub our hands. Usually we use a brush similar to this one. This is called a BDEZ scrub brush here. And this brush and this soap that is within the brush here is outside of the operating room. We have sinks here that we can use to scrub our hands, and then we have these brushes here. So essentially you can rip this open here. It's pretty easy to open this. If you notice that within the package here there's a little plastic piece. This plastic piece is to clean under your fingernails. So before surgery you want to make sure that you place this item here under your fingernails and clean out all the dirt and gunk that's under your fingernails. Usually you have to remove your jewelry, your watches, and your rings before you actually scrub. So the first thing that you want to do is actually wet your hands. At any part of this process of scrubbing your hands have to be straight up in the air. They should be never below your waist. And once you actually scrub, you should not touch anything that's not sterile. You're considered sterile after scrubbing your hands. So the brush, the first thing you want to do is use the bristle part here. The bristle part is essentially to be used for your fingernails. Usually I will do this for 20 to 30 seconds and each of my fingernails to make sure that they're clean before I go into surgery. You notice my hands are always up this way. And after you clean your fingernails, you turn it back over and use the softer part here. This softer part can be used to scrub the dorsum of your hand. Some people say do this for 20 or 30 times. Usually I start off at each finger, I get each side, go into each finger here. And then you use the palm of your hand, the same softer portion of the brush here. I usually work my way down the forearm and then stop usually about mid-forearm or so. Then I'll repeat this process on the other hand. So using the bristle type portion for your fingernails and then turning it over to use the softer portion for the dorsum or the back portion of your wrist, getting each finger, both sides, and then the palm of your hand. And after you scrub, this essentially you can throw away. It's essentially a one-time use. And then I just basically throw it in the trash can. Hands are up in the air. And essentially I'm just rinsing off with the soap of my hands. So when I walk into surgery, my hands are usually like this. The operating room tech will hand me a towel to dry my hands. Usually someone opens the door for you, so you're not touching anything that's not sterile. You put your sterile gloves on, you put your sterile gown on. I hope you guys learned something in this video. Thank you for watching. Make sure you subscribe, and we'll see you on the next one.